This is another case of odontogenic abscess imaged with ultrasound and CT, and I think it's kind of a neat case to show the correlation between two different imaging modalities. The case involved a 16-year-old male who presented with left facial pain, swelling, and external drainage. Initially, an ultrasound was performed, which demonstrated a well-circumscribed hypoechoic collection without internal flow but with some peripheral vascularity. Within this fluid collection, there was a reverberation artifact, which can be seen by these multiple horizontal echogenic lines, and this can be seen when there are two reflective surfaces right near one another, and it can be seen in certain types of calcification or when there's fluid that is thought to be entrapped in pockets of air. And so in this case, this is probably suggesting air within the fluid collection. The ultrasound also showed the underlying mandibular cortex, and there appeared to be a break in the cortex right here. Here's the CT of the same patient taken subsequent to the ultrasound, and on axial section you can appreciate the left mandibular second molar has been treated with root canal before, and there's also a large coronal radiolucency. On sagittal imaging of the roots of that same tooth, again there's root canal filling material and a large periapical radiolucency. Here's another axial section CT and bone windows showing the cortical dehiscence, and this likely corresponds to that defect we saw on ultrasound. This axial section in soft tissue windows nicely demonstrates the abscess, and you can see how superficial it is. And when it's this superficial, especially with the patient's history of drainage, this could represent either an osteocutaneous fistula or a sinus tract. Here are two additional axial and coronal CT sections demonstrating the fluid collection and the air within the fluid collection. So here again, I just want to show the correlation between the CT and ultrasound findings. On the left, you can see the ultrasound demonstration of the fluid collection, and on the right you can see an axial section CT also demonstrating that same fluid collection. And if I zoom in and rotate the CT, you can really see how similar this is to the ultrasound. Same thing with the other ultrasound finding, the cortical dehiscence, showing the same dehiscence on axial section CT. And once again, if I zoom in and rotate on the CT, you can see how similar the ultrasound and CT imaging appearance is. Finally, I want to show the CT correlation of the reverberation artifact that we saw on ultrasound. And so again, if I zoom in and rotate, I hope you can appreciate, here's the cortex of the mandible, here and here. Here's the fluid collection with the air in it, and here's the fluid collection with air somewhere in here. To summarize, ultrasound can be a useful tool when evaluating the soft tissue extension of odontogenic infections. Reverberation artifact within a fluid collection may suggest the presence of air, and CT, if indicated, can be obtained to further evaluate the mineralized structures such as the bone and teeth.